And we want to start right away with some of our answering that we're trying to do of your coronavirus vaccine questions. We know as we anticipate the rolling out of a vaccine here in North Carolina at some point soon, we want to make sure that you have all the information you need. Earlier today, I spoke with Dr. Cameron Wolfe, who's an infectious disease expert with Duke University Health. So let's dive right into that. First question comes to us from Jennifer Price from Indian Trail, who asked us, how long will the vaccine provide protection? Take a listen.
Yeah, that's a really good question. And we don't know yet is the right answer. So, we've only been dealing with this pandemic for less than a year, let's be honest. And in fact, whilst we've got wonderful information so far on the efficacy data of the vaccine so far and the safety data, we have not had enough time to understand its durability. And so, as your person there would well know, vaccines come with a wide variety of duration. Some flu vaccines you need to give every year, other ones tetanus needs every 10 years. We don't know how long this is going to last. I think that's an important part of some of the earlier phase trials is that they continue to track people even now to see how well that vaccine lasts. But we are not going to know that data in a timely enough fashion.
We are also getting some questions about side effects, particularly for folks who have compromised immune systems. Are you hearing of anything, as far as possible side effects for those particular folks?
Yeah, we've certainly not heard of anything, or nor can I think of anything really that would drive an expectation that they would have more side effects. In fact, we wrote recently for the Society of Transplantation that we, in fact, are going to recommend that our immunocompromised patients who get chemo or have had transplants, in fact, move forward if we're allowed to get the vaccine. And I think the reason for that is that it's a balance. We know that folks who are immune compromised have a greater risk of a more significant issue related to COVID infection. And like we were talking about, we're in the midst of a pandemic right now. So in fact, that greater risk is balanced against what I think is the main concern for the vaccine, which is that it may not have as great an efficacy in those populations as the general sort of community. But even giving some protection to those individuals is going to be better because of their risk of a more significant illness.
We've also been getting quite a few questions from folks who are in a caregiver scenario. In fact, Ruth and Sylvia are texting us information about their particular scenario and asking, where will caregivers fall on this rollout plan?
Yeah, that's a really good question. So I think it depends a bit on where someone provides their care, to be honest. One of the groups who are ranked as the very top in our prioritization are folks who either work in or live in long-term nursing facilities. So if that's where someone provides their caregiving, they'll be on the first sort of phase of people receiving a vaccine. If it's home caregiving that your two callers there are interested in, that will be a little bit later because it's, they're lower down the phases. But I would say that particularly even in that group, we would hope that we can really get into the caregiver community sort of in the not maybe the first phase, but pretty close to it. And sort of, first quarter of 2021, I think is a realistic expectation that we'd be reaching out to folks in that group.
Our final question comes to us from Christy Smith from Caldwell County, and she explains that her husband essentially is in an at-risk group due to a health condition, and she wants to know when he and others in his situation or how they might be notified that it's their turn to get a vaccine.
I would frame that in the context of where does that individual normally get their healthcare from? Because the way we understand whether someone's in a high-risk category or not is we will be leaning on hospital systems like us here at Duke, on individual providers like primary care physicians and then county health departments to reach out to people who they look after when their time is here for it to be their turn. And so fairly quickly after we get through the healthcare provider sort of first wave, where we will be into vaccinating community members who come with high risk sort of comorbidities. And so I would simply ask that person make sure that his or her hospital or physician provider knows of their risk reasons, and they should expect to hear from them, again, probably towards the first month or two into 2021.